This video is for education and entertainment purposes only. Please consult with your healthcare provider before making any changes to your health plan.
Hey, beautiful soul. It's Jacqueline from the Lost Labia Chronicles in partnership with Lichen Sclerosus Support Network. If you are looking to empower yourself with information, find acceptance, and reclaim your life, then please subscribe to our channel and keep on watching. And if you have a friend or family member or loved one with lichen sclerosus, and you want to learn more about the physical and mental health aspects of living with lichen sclerosus so that you can better support them in their journey, then please subscribe to our channel as well, and please keep on watching. Today, I am joined by the wonderful Yohanna, and Yohanna is the founder and director of Vulvar Cancer Awareness Forum, and we are going to be talking about vulva checks for vulvar cancer today. Now, I did a video a couple of months ago on vulva checks for lichen sclerosus, which I will leave a card for up here, and I will also leave that linked in the description box below. And that video was really focused on what to look for with the vulva check in terms of lichen sclerosus. Then a bunch of people were like, okay, that's awesome, but also what should I be looking out for with respect to vulvar cancer? What do those signs look like? And so a lot of folks had questions about that, and I thought, phenomenal. I'm going to bring in Yohanna and get her insight on all these really, really, really important questions. So that's the topic that we're going to be diving into today. So just as a quick content warning, we are going to be discussing vulvar cancer and parts of Yohanna's journey. So please make sure to do some self-care after watching this video, as it can sometimes bring up a lot of emotions in us. Lean on your support resources, or come back to the video when you're feeling grounded and safe. As always, if you find the information in this video helpful, please give us a thumbs up, a like, please subscribe to our channel, and please drop us any questions or comments that you have in the comment section below. We love, love, love interacting with you. So Yohanna, welcome. We're so happy to have you here with us today.
Thank you so much. Thank you for having me. It's just amazing that we were able to connect, and you are just as amazing as wonderful as you gave me credit for. So thank you so much for having me today.
Thank you. Yeah, Yohanna and I were just chatting about how it's unfortunate that we connected in the way that we did, but how there's also a lot of gratitude wrapped in that there's such a beautifully supportive community here. And Yohanna really is an amazing resource in this community. Vulvar Cancer Awareness Forum, the mission is really to bring awareness to a gynecological cancer that is often ignored and really doesn't get a lot of attention. And then the other part of that is really to provide a lot of education and support. So Yohanna is just this beautiful soul inside and out. She is so brave. Her passion and knowledge and all of her advocacy for this community is outstanding, and we are just so grateful to have you in this space. So thank you.
Thank you so much for your kind words. Don't make me cry. Don't make me cry. I have some makeup on. It's gonna
You know
run.
what? I actually made somebody cry in the last recording. I didn't mean to. I gotta tone it down a little bit.
No, it's sweet and it's kind. It's sweet and kind, and actually encouraging and uplifting. Thank you.
I'm glad to hear that. So before we kind of dive into, vulvar cancer and vulva checks and what to look out for, I'd love if you could share a little bit about your journey with lichen sclerosus and vulvar cancer.
Okay. So really, I guess I would have to start in my childhood. As a child, I think it was maybe around 8, 9 years old, I started to constantly have an itch, as we used to refer to down there.
Right. Yeah.
Back in the day.
We say the name.
Right, exactly. So it was like this itch down there. And unfortunately, I didn't grow up in an environment where I was cared for as a child. There was a lot of abuse and neglect but that is overall a different topic. But due to the neglect, there was really no one looking out for me like, hey, she keeps constantly scratching down there.
Mhm.
What's going on? And so this itch, as far as I still remember it from my childhood, it became more and more persistent and started bothering me all the time. I remember in school sitting on the chair and just kind of wiggling in the chair, trying to sort of get some kind of a relief.
Mhm.
And so a few years went on, and every summer, at that time, for a couple of years already, I would be dumped off at my great grandmother's house in France, which I actually loved because that's where I felt loved and cared for. And my great grandmother at the time, like maybe 3 years later already, when the itch began, noticed she's constantly scratching. So she asked me, what is going on? What's happening?
Mhm.
And I told her I'm just itching down there all the time. And she asked me, since when, has this been happening? I couldn't really put it at the time into a specific time frame. I just said for a long time.
Mhm.
And she took me to a doctor there. And the doctor, I don't even remember what the diagnosis was. Um, Obviously, it was not lichen sclerosus at the
Yeah,
time, but he said something. He took a quick look and he prescribed these pills, which I don't even remember the name of. I was too young.
for
And
sure.
I do remember that these pills caused my urine to be orange reddish
Okay.
during the time frame that I took them, and that was supposed to help, but it didn't. So now to kind of not prolong the story too much, the itching continued. Then there were those moments where there was relief, where it would kind of calm down, and which I now know were flares,
Mhm.
but not being able to put it into words at the time. And that kept going on and on and on until like sort of we hit a peak in my late 20s actually. And so I said, something is not right. Something is going on. I had went to several doctors who really kind of ignored it, didn't think it was anything serious. But I was like, something is not right. So I said, well, maybe it's my nutrition. I need to change something about my eating habits. And I didn't know at the time that all along it was lichen sclerosis. So I kind of try to just deal with it. We as women, or as people in general, I apologize, I want to be gender inclusive. As people in general, we have this tendency to just kind of be like, oh, I deal with it. And
Yeah.
then without being offensive, as females, we especially have that tendency. Oh, just deal with it, keep going, keep moving, still keep
Mhm.
functioning, keep going about what you need to do. Don't stop, don't slow down, don't skip a beat. And that was me. And
Right.
so, even though these moments came where it would get worse, I think things had finally sort of hit a peak at 30 years old, where I said, okay, what could be going on? Internet, Google.
Mhm.
And the first thing I saw was a yeast infection. So I said, oh, that makes sense. But the only thing that I didn't have was this discharge that you typically get with a yeast infection, this clotty
Yes.
discharge, and even the typical smell that comes with it. But I said, well, that's got to be it. I didn't think of anything
Mhm.
bad at the time. Went to the drugstore, got an over the counter product to, try to help with it, and it didn't help. And then I said, well, maybe the soap I'm using, I need to change up. I started switching to products for sensitive skin. I wasn't washing the vagina, only the external part, the vulva,
Yes.
but I said, well, maybe on the external part, whatever I'm using is irritating it. And so that didn't work. So I said, well, the laundry detergent. So you start going down the list
Yeah.
in your mind of
Totally.
what it could
Mhm.
possibly be, right?
Yeah.
So switching that up and still no change. If anything, the change that I had was it getting worse.
Yeah.
And so eventually, um, I was at the time, I should mention that I was without any health insurance coverage at the time.
Okay.
So I couldn't just say, let me go to a doctor because it
I
was a
see.
bill that I couldn't really pay for. And so you try to deal with it, which is another problem and points
Huge
towards the
problem.
flaws in our healthcare system. But again, that is also a different topic, probably for another show. The
Yep.
flaws in our healthcare system that promote late diagnosis, diagnosis of
Yeah.
serious illnesses, etc. But after about a year of trying various things, I'm approaching like 31. I woke up one morning with my vulva having swollen up about 2 to 3 times its size.
Oof.
It was very painful. Uh, I mean, I can't even describe it. I called my mom. My mom and I are very close. I said, Mom, you have to look at this because this is
Hmm.
not normal. Something is going on. She took a look. Her eyes got wide and she said, we're going to the emergency room. Because not only did she see swelling, but she saw all of these white patches all over the
Hmm.
place. And we went to the ER, and the doctor, emergency room doctor, he took one look. He didn't examine, he didn't touch, he didn't do any tests, he didn't do any swabs. And he said, oh, it's a yeast infection. It's just a really, really bad yeast infection, and you need to be treated with prescription medication for it. Gave me prescription for some pills, the most common ones that we know probably in North America. Don't want to make
Hmm.
commercials or anything, but
Yeah.
and and used it, but there was no change. So eventually, as things continued to worsen into pain and even open sores, ulcers, a friend of mine who I shared with what's been going on, she said, listen, you can go to X, Y, and Z hospitals. They have a clinic, they have a program for people that don't have coverage. You can apply for
Yes.
it. And if you get approved, you can see all the doctors at the clinic. She
Right.
said there will be residents, but there is an attending that oversees everything. I'm like,
Okay.
great. Did that, went, got approved for 100% coverage.
Amazing.
No, yes, I was so excited, so happy, so grateful. And the first thing after the doctor examines me and takes a look is like, oh, it's just a yeast infection. I'm
Again.
like, wait a minute. That's what the emergency room doctor about 3 months ago said. I used the pills. There is no change. And she said, well, this is just the worst yeast infection I've ever seen. You probably need to stay on a regimen of of that medication for a while to clear it up. Because as you said, and she was like, as you said out of your own mouth, you've been dealing with this for years now.
Hmm.
And so it probably was just a yeast infection that never got treated and now got this bad. And I said in my mind at the time, like, it doesn't make sense because the typical discharge, the vaginal discharge, and all of my
Hmm.
issues were externally, not internally.
Yep.
And, so I didn't feel comfortable questioning it at that time because we sort of sometimes get into this space of doctors are authority figures, not
100%.
realizing that doctors are not authority figures, but they're really just working for us, for the patient.
Hmm.
But I didn't have all that knowledge at the time and awareness and, empowerment,
Yep.
unfortunately. So, okay, did that, no change. So we go on for several months of this medication. Now I'm actually developing bacterial vaginosis because, there was such an imbalance
Of
from
course.
staying on this
Yeah.
constant medication. So that was an additional issue. And after about a year of this back and forth to the doctor, she said, okay, let us refer you to the gynecologist that comes here. Now imagine all this time I had no access to a gynecologist because I was bound to this one clinic
Yeah.
where I could get care. I couldn't go out and see somebody else. And so she finally makes the referral. And I'm thinking, finally, the gynecologist is going to figure out what's going
Yeah.
on. And here we are. I had to wait probably a couple of months for the appointment because this one doctor comes one day a week to this clinic with
Yeah.
a
Okay.
gazillion patients. And he examines me, and the first thing he says, oh, I know what's going on. I'm like, oh my gosh, finally. And he says, it's a yeast infection.
Oh, for. Mm.
I was like
Dear
on this
Lord.
on this on this gurney, and I was ready to just scream.
Yes,
I said, "You've got to be
100%.
kidding me!" And I did speak up. I did say, "How can this be a yeast infection? Because I've been treated for almost an entire year now with this medication with no change." And he
Hmm.
said, "Oh, it's just really bad. We need to treat it several different ways." And he was very nonchalant about it. In the meantime, there were those white patches, there were those ulcers, you know, and you still saying it's a yeast infection. So again, not knowing at the time the things that I know today, I went along with it. And to kind of make it a little bit fast forward, we are now 3 years into it. In the 3 years time frame that I've been going and seeing the doctor and the gynecologist off and on, they came up with several different misdiagnoses of what it could be. They finally realized, hey, this is not a yeast infection. And then it was like, oh, well, maybe she has an STD. Now, mind you, I was already checked for all those things and
Right.
everything was negative. And he was like, well, it could have been dormant at the time, so we're going to recheck everything. So they checked for every STD under the sun. And when it
Hmm.
came back negative, they still said, oh, it must be an STD. And the gynecologist wanted to treat me for an STD that he thought it might have been without a positive test for anything, which I completely refused.
Right.
So
Good for you.
yeah,
Yeah.
I was like, I'm not going to take something. This is negative. And mind you,
100%.
at the time, without, again, this is touching a little bit into the other side of just my overall life story. The only time there was intercourse was the abuse and the rape in my childhood. And I
Hmm.
had not been sexually active my entire adulthood life. Now, I'm not saying you couldn't get an STD from the rape because you can, but everything had been negative. I had been checked several, like once went into early adulthood, I
Yeah.
wanted to get checked to make sure that this man didn't carry anything that he passed on.
100%.
So I was like, no. Um, Also, during that same time, the resident doctor that was assigned to me finished her residency, and a new resident doctor took over my care,
Okay.
which was amazing. She was so compassionate, she was kind, and you could tell she had a sincere concern once she looked at, my case, the 3 years prior, everything that's been going on since I've been coming there. She was like, okay, we got to figure out what's going on with you.
Hmm.
And she actually had tears in her eyes when she said, I'm so sorry you've been suffering for so long. And she said, I can see when I look at you, when I examine you, there's clearly an issue.
Yeah.
And so she said, let me walk out. Can I leave you for a moment in the room? And I'm gonna go talk to the attending and I will come back.
Okay.
And so she came after, I don't even know how long, came back in, and she said she spoke to the attending, and without kind of saying too much, she made it known that the attending wasn't much of help to her.
Right.
And so she said, this is probably going to make me look bad as a resident doctor, but I'm just going to go ahead and pull up Google and put your symptoms in. And so that's what she did. And what came up was lichen sclerosus. And so she said, it sounds like this could really be it.
Yeah.
And everything that you're describing, everything that we see here about lichen sclerosus looks like that could be the diagnosis. Let me go to the attending, speak to her again, and see how we're going to treat it. This is suggesting steroids. So let me talk to her because, she has to sign up. So she came back and she came back with a prescription for clobetasol, which
Hmm.
every lichen sclerosis
Yeah,
warrior
of course.
probably knows. For those that are watching that do not know, clobetasol is basically the atomic bomb of steroid ointments, which is the main treatment used in lichen sclerosus to help bring down flares and sort of keep flares at a minimum. So that's what I was given. I was told to use it according to the typical regimen for lichen sclerosus, and I noticed a minimal change, but not as much. So
Right.
we go on now for about 2 more years of just using the ointment, constantly going back and forth to the doctor. Okay, you have to continue using it. You have to begin to minimize stress in your life. Try to change your nutrition to help the situation to finally get rid of this major flare. But things actually continue to get worse. Now
Mm.
we had already went from itching to pain, but now we went to excruciating pain. Pain while I'm sitting became almost impossible, especially on hard surfaces, painful urination, burning, even more ulcers. And the first ulcer that started like 5 years ago was actually went from like a little less than a penny size
Hmm.
to like about this big, bigger than
Wow.
a American dollar coin. I mean,
Yeah.
much bigger. And new ones kept popping up. And I said, something isn't right. And I told her, I said, I'm not saying it's not lichen sclerosis, but I feel like something else is going
Yeah.
on. Now, mind you, they've never done a biopsy to confirm lichen sclerosis or a
Hmm.
biopsy to see if there could be anything else going on. And I was like, no, I mean, cancer at the time never crossed my mind. I have to be
Okay.
honest, it never
Yeah.
crossed my mind because I had never heard of vulva cancer. I knew what the vulva is, but I didn't know you could get cancer there.
Hmm.
And so I was like, finally, 5 years into it, like we needed almost 5 years. I said, I think we need to do a biopsy. And she was like, you know what? I actually agree. Let me go back to the attending, get her to sign off. She comes back and she says the attending declined and said it's not necessary, that you just need to continue using the ointment and we need to increase the frequency of the usage. And I was like, okay. Now, every month that I came back, I came once a month, like, I want the biopsy. I want the biopsy every time. And every
Yeah.
time she was like, I agree, you need a biopsy. And every time the attending declined. Now, 9 months into asking for a biopsy, I was just in so much pain and the itching was so unbearable that I was just constantly in tears.
Hmm.
And I said, I need the biopsy. I'm not leaving without an order for it today. I need the
Good for you.
biopsy. And she says, I know you do. And she has tears in her eyes. She was like, I know you do. And she walks back to the attending, comes back and said she still declined. And I said, mm-mm. And now my whole personality, I'm normally
Yeah.
like this sweet, calm,
Hmm.
peaceful kind of person, switched. I said, bring her in here.
Yes.
I
Yes.
said, I'm tired of this. I'm sick and tired. I need a biopsy. I need to know what's going on. And I'm crying and I'm like very, very firm. And, I'm like, I'm not mad at you right now, but I'm
Hmm.
mad at this doctor that sits in his room and plays God and makes life and death decisions over a person, a patient she's never come eyes to eyes
Yeah.
with. I said, bring her in here. And so after a while of waiting, the door swings open so hard that it bounced back from the wall. And this doctor comes in, this woman, and she goes like, "Well, what's the problem here?" And I was taken aback for a quick second,
Of
but I had a
course. I
quick
would have been
recovery. I mean, I had a quick
too.
recovery though, and I was like, you are the problem.
Yeah.
You I said, I need this biopsy and I'm not leaving this place today until you sign off on this biopsy. And she was like, well, I'm saying you don't need it. And I was like, and I said, I don't care what you say. I said, you have never seen me. You have never come to examine me yourself. I need a biopsy and I'm not leaving here until I get it. I said, I've been coming here for almost 5 years. And in this entire time frame, I have spent a lot of time waiting in the waiting room. And there are the patient rights big as day on the wall, and I've read them over and over. And they say that I have a right to every diagnostic test necessary to figure out what the problem is. I said, so now figure it out,
Yeah.
And she was like, well, I don't appreciate your attitude. And I said, I don't
Don't
appreciate
care.
yours. I said, I don't appreciate yours, nor do I appreciate you. I
Hmm.
said, and I said, you know what? How about we take a look? Now, this was really drastic. I was still, on the table. I still had a sheet over my legs, and I
Yep.
was just like, "How about you take a look?" And just spread my legs.
Oh my
Afterwards,
gosh.
after I thought about it later on, I said, "I can't believe I did it."
Ah,
But
you're a rock
I
star. I love
was
it.
so fed up. I'm like, "Take a look."
Yes.
And she briefly glanced and she said, well, I don't think you need it. And I said, okay. we can do this two ways right now. I said, you can sign off on this biopsy, or I can walk out of here and call my attorney and then come back with my attorney and see how that goes. How about that? And she looks at the resident doctor, and this clipboard where I guess my paper for the day was on for,
Mm-hmm.
I can't think of the word right now. She hands it to her very roughly, and she says, here, order the biopsy. And she storms out. So about a month later, I finally had the appointment with the gynecologist who was going to do the biopsy. And this annoys me all over again when I think about it. So I'm on this table with my legs spread open. He looks, he's getting ready to inject lidocaine in different places to numb the area. And he says, well, you really don't need a biopsy. You just have a yeast infection. I lost it. I lost it. I was like, can you just shut up and do the biopsy? Like, I lost
Seriously.
it. I was like, be quiet. Just do the
That's
biopsy.
unprofessional.
And
You're not supposed to
yes,
make any comment other
exactly.
than, okay, I'm going to inject some lidocaine.
Hello.
I'm going to
Yes.
do this biopsy
Right.
now. All
He
right,
didn't
everything
talk
is.
me through the process, nothing. And so the injections go in, they hurt like hell. And
Mm-hmm.
I'm like in tears because everything is already raw and, sensitive down there from everything that has been going on. And he begins the biopsies, and he took several, and one area I could feel it. Now, I'm
Mm-hmm.
not a screamer. I'm not a crier. I mean, like boohoo kind of crier over
Yeah, yeah, yeah.
pain. I just have these silent tears, and I start shaking sometimes
Mm-hmm.
when it gets really bad. And so I'm shaking, and he looks at the nurse and he says, "What's wrong with her? Why is she crying and shaking like this?" And the nurse says, "Because she's in pain." And the nurse
Good for the
goes,
frickin' nurse.
"Yeah." And listen, that was an itch. And she says, "I wonder how you would feel if somebody would shove some injections into your private area and take
Amen.
some chunks out of it." And so he looked at her and he said, "We will be talking about this later." And she said, "Gladly." And
Mm-hmm.
so the biopsy's done. 2 weeks later, I go back for the results. The results are not back yet. They said they had to send them for additional testing outside of the hospital. And I'm like, well, what was the preliminary findings? And they were like, oh, we don't want to talk about that yet. I'm like, okay. So a week later, I get a call from a completely different hospital and clinic. They are sister hospitals,
Right.
but a place I've never been to, a clinic I've never been to, never seen any of the doctors, and they say, "Oh, I'm calling to schedule you to come in to get your biopsy results." And I'm like, "Why? I've never been to your place. I'm
Yeah.
going back to, where I've been, and I don't have coverage for you." And she said, "Oh, no, we're going to get that fixed. Can you come in tomorrow to do the paperwork for the charity care? And then we make the appointment after." And I'm like, "No," because I wanted to see my resident doctor that has been so amazing since she
Mm-hmm.
came. And so I'm calling the other place, and they're ignoring my messages. They're ignoring my emails. Eventually, I said, well, let me just go through with this at this other place to get the results to see what's up. And so I go, and the doctor, it was a female doctor, and she says, so we have your biopsy results. And she said, I'm not one to really talk around the bush because I feel it's important to just get straight to the point.
Yeah.
I'm not trying to be brass, she said, but you have vulva cancer. My mom was with me, and I'm sitting there, and my mom and I looking at each other like, what? What, like, what did you
Yeah.
just say? Vulva what? And she said it's cancer of the vulva. So they found invasive squamous cell carcinoma, invasive cancer. And she said, I'm not qualified to treat that. I need to refer you to a gynecological oncologist. But she saw my look, and she said, you know what? Why don't I give you both a few minutes,
Mm-hmm.
and I'll be back. And I was like, okay. And we sitting there and kind of in disbelief, and I'm
Mm-hmm.
like, cancer. And a few tears started coming, like not excessive crying, because it was sort of between reality and surreal at the same time.
Yeah.
And so we took a moment to kind of, catch our breath, so to speak. And the doctor comes back, and she makes the referral. And she referred me to the most amazing gynecological oncologist and most amazing doctor I could have ever had. He is, I mean, the kindest, most compassionate, most thorough physician I've ever come across. And long story short, here we are, a cancer diagnosis. We didn't know the stage at the time. Obviously, get the referral. Uh, he does scans to see if it had spread anywhere, and we come to the determination and conclusion we need surgery. He thought in the beginning that one partial vulvectomy, partial bilateral vulvectomy, bilateral meaning both sides, including the clitoral tip, could fix it. That it didn't seem like it had spread too far. So we had the first surgery, and unfortunately, we didn't get clear margins. Clear margins is what you look for to determine that you got all the cancer, you excised all the cancer, and nothing is left behind. And so, long story short, now we're doing more tests, more, biopsies to figure out, okay, how far does this go? And the conclusion was that I actually already had stage 3 vulvar cancer. So here we are with stage 3 vulvar cancer that could have been diagnosed a little over, like a little more than 5 years prior to this. Probably still in a stage 1 kind of, state, with a surgery that could have probably really been just that one surgery and done, or not even a vulvectomy, but a wide local excision. And so here we are. That's how we got to the stage 3 vulvar cancer diagnosis. This cancer didn't really act typical. Squamous cell carcinoma is considered a slower growing cancer. In my case, it was very aggressive, more aggressive than this cancer typically behaves. And so that meant even after several more surgeries where we got clear margins, actually, it came right back. And it kept coming right back. And in the meantime, we still have the lichen sclerosus. The first surgery confirmed the lichen sclerosus diagnosis, with an active flare, which was probably, or not probably, which was fuel for all the stress from a cancer diagnosis and surgeries.
Yeah.
And, it just fed right on into this. And to kind of come sort of to the conclusion of my cancer journey, which is extensive. So, but obviously we don't have time for everything. Now, I was diagnosed at 36 years old. I'm 41 now, being 42 in June. And I've had 18 surgeries. I've had radiation. I've had chemo twice. I'm now currently in what they call NED, no evidence of disease. For 2 years now, I've been clear. It's not considered remission until 5 years. So we're constantly on the guard. I'm constantly doing my self-exams several times a month, to make sure nothing is there, because I actually caught all of my recurrences, my external recurrences, not the ones in my inguinal nodes, but the external ones.
Yeah.
Every single one of them I caught. When I would go to my doctor, I'd be like, it's back. He tells the resident that he teaches, all right, get ready, order the biopsy. If she says it's back, it's back. Let's go in the OR, do an exam under anesthesia, and do the biopsy. So I caught them all on my own with my self-exams, with taking pictures. But 2 years we've been good. But unfortunately, being no, clear of cancer at the moment, or having no evidence of disease, doesn't mean you're good, because now you're left to live with the aftermath of cancer. But we're focusing on the exams today. So I learned very quickly how important these vulva self-exams are, because you will be the first one to notice when something is wrong. You have to get to know your normal first. Get to know your normal, and then you'll be able to realize and notice when things are wrong. It's so important, and it's one of the most important things that you can do as a person to catch vulva cancer early.
Yes,
Because
and
early,
it's so important. Like
yes.
your story, like I was fighting tears, honestly.
Listen, I was trying myself. Usually when I tell it, the tears just come, and I said, you have to kind of stay focused to get this
right.
out.
Right. And I'm trying not to cry, and like I'm shaking because it's so maddening. Like, I'm mad for you. This was gross, like colossal medical, like they let you down so hard at so many points. And while you were saying, that doctor that kept saying no to the biopsy, I'm like, I hope that person never forgets your face.
Listen, and she won't. You
hope,
know how she won't? I
oh,
went back. I'm sorry to interrupt. I went
no, that's
back
fine.
and I didn't have an appointment. I just went to the place, and one of the medical receptionists, she's been the sweetest, and I was like,
Mm-hmm.
and so I want to go see her. And she said, well, I don't know if she will see you. I said, oh, she will see me today. She will. She will come out here. And she went back and she was like, she don't want to see you. And so I kind of walked back to, and she let me, she walked back to the area where her office is. And I started calling her name out really loud. It's like, Dr. So-and-so, I would
Yep.
like to speak to you. Dr. So-and-so, I would like
Mm-hmm.
to speak to you.
Yep.
And so I kept getting louder with each one. She comes out and I said, I just wanted you to look at me. I
Mm-hmm.
wanted you to look at me and I wanted you to see that due to your negligence,
Yeah.
this person, me, ended up with stage 3 cancer that could have been caught a long time ago due to your negligence. And I said, I want you to also know that you are a coward. You had my biopsy results sent to a different place when it came back as cancer.
Yeah.
Instead of facing me because you didn't want to look at me anymore. I said I could have gained a little bit of respect for you had you
Mm-hmm.
had me come back, get my results here,
Yep.
and you would have came in a room and you would have apologized and
Mm-hmm.
said, I'm so sorry. I could have gained some respect for you, but you were a coward. I said, and if I die from cancer, it will be your fault.
100%.
And so she stands there silent. And then, I said, now have a good day. And I just walked off. So no, she won't forget me. I don't think she will.
Good for you. I honestly hope that she never forgets
Yeah.
because, and I'm also so frustrated, and I think this really speaks to just how much awareness we need to raise in the healthcare providers,
Yes.
right? Because,
Yeah.
With respect to both lichen sclerosis and vulvar cancer, because
Right.
all these people saying, oh, it's yeast, it's like, well, first of all, it frustrates me when I hear these stories because you should swab for yeast. I will die on that hill. I don't care. You should swab for yeast because there's different types of yeast infections. They present it. It is probably one of the easiest tests that they can run. It's a little swab. You open it up, you put it in the thing and ship it off for the lab to, and it's like, you should swab for it. Second of all, I can somewhat understand if on first appearance they're seeing some white patches, why they might think yeast, right? Itch, pain, some whiteness, they might think that's discharge. But again, awareness and education at the patient level, at the healthcare provider level, because the thing that differentiates yeast from lichen sclerosis is that if that was yeast buildup, you can wipe that off.
Exactly.
You can take a cotton swab and it will come off.
Yes.
With lichen sclerosis, it's actually hypopigmentation. It's not a buildup of fluid or discharge. You can wipe all you want and those white patches will not go away. And if you do that to a patient and that whiteness is not disappearing, that should really clue you into, oh, this could be lichen sclerosis, which is known to cause hypopigmentation. So it's like, those doctors, like every single one of these doctors, like they failed you so hard by not being current, by not, and even just, okay, like, come on, like years of yeast treatments with no results and you're still hung up on that. I understand.
Ended up just taking the stuff because I was like, this is not it.
Well, I mean, of course. And it's just like, again, it's like, doesn't that give you reason to pause and reflect and think, maybe something else is going on? Because there are cases of aggressive yeast. You have super infections. There's Candida glabrata. There's embedded yeast. And those do actually, those are very aggressive and they do require months of treatment, but not years. And typically there's some improvement. But where there's improvement, you're getting worse. Right? So again, I'm thinking there's all these obvious clues that to me would tell me that you should take a moment and reflect. And, like the good, compassionate doctor, if you don't know, open up Google. It's fine. Nobody expects you to be God and to know. That's just it. You can issue a consult. You can just, call up a different hospital and be like, I need a consult with X doctor. I have this case and let's chat through it. So it's like they just failed you on every single
Yeah.
level. And it's so maddening because early detection for lichen sclerosus, first of all, is so important because if you
Yes.
catch LS
Yes.
early, you can prevent a
Yes.
lot of changes. A lot of
Exactly.
the sclerosis aspect, which is the
Mm-hmm.
scarring and the
Right.
anatomical
Right.
changes, if you catch
Yes.
LS early, you can
Mm-hmm.
prevent that. And
Exactly.
furthermore, if you're catching LS early and you are putting that patient on the proper treatment plan,
Mm-hmm.
their
Mm-hmm.
risk for vulvar cancer
That right
decreases.
there. Yes.
And so this is what pisses
Yes.
me off about hearing
Yes.
your story is that you clearly had
Mm-hmm.
pediatric LS. Like
Mm-hmm.
hearing your story. And so I'm thinking like, had they caught that at the pediatric age,
Right.
you
Right.
you could have had
Yeah.
all of your parts. This could have
Exactly.
never turned into
Yeah.
vulvar cancer. And so it's
Mm-hmm.
really frustrating. And then again, early detection with vulvar cancer, again, is so
Mm-hmm.
critical. We didn't need
Yes.
this to get to invasive, stage 3. We didn't need
Right.
you to be going in with these recurrent surgeries. Like
And
this,
losing everything. When I say everything,
I
I
know.
mean my entire vulva is gone. And then after it was gone, I mean labia minoris majoris,
Yep.
clitoris,
Yep.
perineum. After all of that was already gone, the cancer came back in the vaginal entrance
Hmm.
and then had the nerve to go up under the scars, right, from the previous surgeries where they took the labias and just stitched it
Yeah.
together. So I needed another massive surgery that turned out to be 9 hours long to remove everything in some parts down to the bone, including muscle, because cancer had spread so
Yeah.
extensively again. And so now we have this huge opening you can't close. You have no skin to close. So they had to
Yeah.
take these patches from the back of my thighs to rebuild some things,
Right.
to close things up and then rebuild my urethra opening so I can still naturally release
Okay.
myself, rebuild my vaginal opening with a hope to be able to be intimate in the future and rebuild my
Hmm.
perineum. And so all of that did not have to happen. My life
No,
did not have to
it
be
did not.
impacted so much, which is again coming back to this why early detection is key for lichen sclerosis as well as for vulva cancer because typically vulva cancer is very treatable if detected early and if the
Exactly.
cancer behaves in the typical manner, you know. So and these self exams literally can save your life.
100%. I
Save
think
your life.
that's why all of us on social media, if there's
Mhm.
one thing that we kind of all seem to unite on and
Yeah.
agree on, it's the check your darn vulva.
Yes.
Like, I
Check
haven't
yourself.
seen,
Yes.
any advocate that said not to do that. Like,
Right.
literally all of us, again, like,
And
we
don't
talk
you
about
love
the
how every
importance.
beginning of the month we all start black?
Here's the reminders. Here's the
Right.
reminders.
We
Yep.
all like
Here's how to do it.
unitedly
Here's a
putting it
video.
out
Here's a
there
resource.
so no one
Because
can miss it. Yes.
exactly. And it
Mhm.
truly is, it can literally save your
Mhm.
life.
Yeah.
And this is why it's
Mhm.
so important. So there's many pieces. One is to know your normal, right? Because vulvas come in all different shapes and sizes.
Mhm.
So my friend, my hypothetical friend here, she might have had
Mhm.
a mole on her labia majora
Mhm.
since birth and the doctors
Mhm.
checked it, it's completely benign. So that
Right.
mole isn't indicative of cancer per se. That's
Exactly.
part of her
Yes.
norm. But if
Yes.
I don't have a mole, so if I go
Mhm.
to do my vulva check, and actually at the time that we're recording it, it is the first of
Right.
the month, so I'm doing my vulva check tonight.
Yes.
And if I saw a mole,
Mhm.
that would signify to me that
Yes.
there's a change in
Something
my
is going
baseline
on. Right.
and there's something going on and I
Mhm.
need to take action. And that's why
Right.
it's so important to know your normal. And then
Yes.
the second piece that we keep harping on because it's such an important point is early detection. If
Yes.
vulvar cancer is
Yes.
caught early, it's very treatable, like you
Mhm.
mentioned. This is
Mhm.
why it's so important.
Yes.
So again, I do have a video on how to do vulva checks, what you need,
Mhm.
all that will be linked.
Mhm.
But let's talk
Excuse me.
about when people are doing their vulva checks, what kind of
Mhm.
things like visual cues, visual
Mhm.
signs are they looking for that they might want
Right.
to, pay attention to and that could be
Mhm.
indicative of, vulvar cancer?
Right. That's actually a very good question. And it's also a common question we at VCAF receive a lot, although we do attach the information. Oftentimes it's their personal interaction that they want.
Mhm.
So some of the things that you absolutely want to look for are skin changes like, for example, the mole you already mentioned, right? Moles, if you never had them before, or if you have a mole, but it begins to change in size and shape, right? You also want to look for like lumps, any kind of lumpy tissues and area. You want to look for something that can resemble pimples. You want to look for something that can look like a wart or cauliflower-like growth. You also want to look for any pigmentation changes or hyperpigmentation, right? Like red or white or even pinkish lesions that can also be raised at times, and not smooth as the rest of the skin. You also want to look for any type of like sores, ulcers, medically they refer to as ulcers, anything that's unusual, bleeding, external bleeding on the vulva. We're not talking about your vaginal bleeding, but external bleeding. So those are some of the very common things that you absolutely want to look for. Also, one thing that is important to kind of check are the Bartholin glands, because quite a few of vulvar cancer patients actually develop cancer in the Bartholin gland. The
Oh,
Bartholin
interesting.
gland,
Okay.
yes, is the gland that produces moisture and secretion that, can also help in the intimate parts of our lives. So many develop cancer there, and
Right.
oftentimes it is misdiagnosed as a Bartholin gland cyst.
Right. Yeah,
So
because that
it's,
can
yes,
happen.
exactly. It can happen, but if you find that the Bartholin glands are kind of found in the entrance of the vagina,
Yeah, I'll pop a picture up on the
yes,
screen when we're
awesome,
doing that. Yeah.
awesome. Yes. And so if you feel that they feel lumpy, it's an indication something is wrong. Even if it's just a cyst, you still want to get that checked out. So those are some of the common things you want to look for. You also do not want to leave out your perineum, the space between your vagina and anus, because the anus is still also part of the vulva. So you want to check the perineum for some of the same things that I already mentioned. But what we find or hear often is that when there is cancer on the perineal area, it's usually these patches that can be white or red that turn into ulcers. So you don't find too many lumps in that area, but these types
Okay.
of patches that you want to look for, and ulcers. And then absolutely check the anal area as well, which can also develop these patches in case of vulvar cancer, but you can also develop lumps. So it's important to kind of go around the skin around the anus. We're not saying go into it, just around the skin, and
Yeah.
feel for any changes. You might not be able to see them properly, but you can feel. So with the vulva self-exam, it's important to not just visually check. You want to check also by ways of touching sensation, you know, and feel for changes as well.
I love that because I think that's something that we don't always hear. We tend to think of vulva checks as, a check. I'm looking with my
Yeah,
eyes and the
yeah,
mirror. And I think that's really, such an important thing to emphasize with these checks is to also get the tactile feedback
right,
from your
exactly,
fingers, because there are
exactly.
some lumpy parts that
Yes,
we might not be able to visually detect.
right.
But if I was just kind of, you
Mm-hmm.
know, touching and examining that area with my
Yes.
hands, I might be able to catch something.
Mm-hmm.
And then there's also, issues with accessibility in vulva checks. So
Mm-hmm.
some people, depending on their body type, it's hard for them to look.
Mm-hmm. I'm sorry.
So that can be
Mm-hmm.
a huge challenge. There's no worries. That can be a really big challenge for folks.
Mm-hmm.
And so, if you can't see, then,
Yeah,
the hands can help. And for folks who are,
exactly.
blind
Exactly.
or have vision issues, that can be another
Mm-hmm.
great tool, is to get
Yes.
familiar with not, how your
Mm-hmm.
vulva feels. What does it normally
Exactly.
feel like, so
Yes.
that you can
Yes.
say, maybe you can't see it, but you're like, hey doc,
Mm-hmm. Right.
I was
I
doing my
felt
vulva check
something.
and
Mm-hmm.
I felt something near the
Yes.
perineum. I can't really see with my eyes, but I would
Mm-hmm.
like, if you could examine that area.
Right.
So I think that's a great
Exactly.
point and something
Yes.
that, really needs to be emphasized
Mm-hmm.
when we talk about this. So
Yes. I
visual
think,
and also
yeah.
tactile.
And one thing that also can be added and that can help, which is what I also use religiously, is taking a picture. So I take
Yes.
a picture so I have something to refer back to. If I move forward like a month or a couple months later, and I compare, is there something different? And not just for comparison's sake, but also sometimes, no matter how you do your exam, whether you lay in a bed comfortably with a mirror, whether you are standing and just kind of, hovering over a
Mm,
mirror, whichever
yeah.
way you do it, it's still easy to miss some of the smaller changes. So taking a picture and then kind of, blowing it up a little bit can
Mm-hmm.
help you also notice if something is different. So it aids in the visual aspect of that exam. And I know sometimes when I, tell people that, hey, take pictures,
No.
especially those, I advocate for pictures all the time and be like,
Mm-hmm.
take pictures with your monthly exams, but especially with patients that have already been diagnosed with vulvar cancer in the support group that I have. And so some of them be like, oh, I don't want to take pictures. I don't want to have that on my phone. And I get
Mm-hmm.
that,
I do
it
too.
can,
Yeah.
be a little bit uncomfortable. But listen, the way these phones are set up nowadays, you can set up a secure folder
I was
that
gonna
is,
say there are like apps
yes,
that can like hide your
right,
picture album behind like a
exactly.
calculator. There's so many
Exactly.
secure ways.
So
Like,
no
yeah.
one will ever get to see it, and it's also protected by ways of codes. And
Mm-hmm.
so if that makes one feel more comfortable, go about it that way, but don't not use that feature that can help just because you're concerned about that, because there are remedies. Now, as far as I'm concerned, they're just in my phone. So in my
Oh, same
gallery,
here. Same here.
like if
If you
I
find
show
my
people,
phone, you will see
yeah,
so many vulva shots, and
listen, I tell
that's
people all
your
the
fault.
time,
That's
yes,
your
if
fault for
I show
taking my phone.
yes, if I show someone a picture, I tell them don't swipe right and don't swipe left because you might not like what you see.
Same
Just look at the picture I'm showing you.
here. Same here. All the time. And it's always like at family
Hmm.
events and the kids are
Yes,
taking my phone and I'm like, yoink,
yes,
nope, nope,
uh-huh.
sorry, little child. That is not for you to swipe through right now. I'm like you. Like I'm at
Hmm.
the point where my health trumps concerns about people
Exactly.
seeing it or
Yes,
anything like
yes,
that.
yes.
But I do understand like privacy,
Right,
concerns.
exactly.
And again,
Yeah,
like I think
yeah,
that the apps that they have out there are a really great remedy to
right.
that concern.
Hmm.
And I agree with you 100%. I think photos are so powerful for so many
Hmm.
ways.
Yes.
And, one thing that, when you're doing these vulva checks, right? Like our bodies are weird. Okay.
Hmm.
Like if you really start looking at bodies and thinking about bodies,
Yeah,
like they're strange. Like
yes.
they really are. And so not every change, in the vulvar area is meaning that you have cancer.
Exactly.
So, that is
Exactly.
something that I do, want to
Yes.
mention.
Yes. Yes.
You might find a lump and it could be completely benign. You
Hmm.
might have a pimple-like
Absolutely.
growth and it could just be
Absolutely.
folliculitis, which again
Yes.
is completely
Yes.
benign. But
Absolutely.
the importance is to know what you're looking out for so that you can
Exactly.
properly advocate for
Yes.
yourself. And
Yes.
sometimes you
Yes.
find changes, like sometimes people tell me, like, oh, I have a bit of hyperpigmentation.
Hmm.
I think this is cancer. And I'm like, well, first of all, I'm not a doctor and I can't give medical advice, nor can I
Yes.
diagnose. So
Yes.
that
And
is
that's
something that
important
needs
to
to be a
mention. Yes.
conversation between you and your doctor.
Hmm.
Second of all, hyperpigmentation can be a number of things, many of
Yes.
which are benign.
Yes.
That said, I still encourage you to
Yes.
have that conversation.
Exactly.
And
Yes.
another thing I say is take a picture because
Yes.
depending on where you are in the world, wait, like I
Hmm.
live in Canada.
Hmm.
You want to see a doctor, you've got a wait time.
Hmm.
So the
Same in the
problem is
US.
that
Yeah.
sometimes, like I can see hyperpigmentation on like the 1st of March. And then
Hmm.
by the time I see the doctor 2 months later, it's
It's
gone.
gone.
And
Right.
now I
Right.
don't know like
Yeah.
what that was. So I like to have that picture so I can say, hey, this popped
Hmm.
up on my labia.
Right.
What,
Right.
does this look, I know it's gone now, but what do you think that is? Because
Hmm.
sometimes that can also just give you peace of mind,
Right.
right? Like,
And also to note, as far as something that popped up, but now what by the time you see the doctor, it's gone, or something in general that comes and goes. on the cancer front, or as far as cancer is concerned, it is extremely unlikely for it to be cancer then,
Yeah.
because vulva cancer will not, like the lesions or the tumors, which really essentially are tumors, will not come and go. So that is something that can give you peace of mind. If it comes and goes, the likelihood of it being cancer is extremely slim. Want to be careful in saying impossible, but extremely
of course.
slim. But at the same time, still, get figured out what's going on, because as you already mentioned, it could be something, completely harmless or easily treatable.
Right.
Not
Like
everything
a
has to be
skin
cancer,
tag.
or right.
Like a
And
skin
not
tag
every,
is completely
yeah,
benign. It's just you can get them
exactly.
removed if you have skin tags on the vulva, but
Yes,
they're completely
yes,
benign, and you don't
yes,
even have to get them removed because they don't
exactly,
hurt. They're just
exactly.
there. So
Yes.
sometimes people want to remove them for aesthetic reasons, or just because
Mhm.
they're annoying, like they catch
Yes.
on like your
Yes.
clothing and stuff. But
Right.
it's like,
Right.
so I think, when we
Mhm.
have these discussions, it's always a challenge to empower folks and have them take an active role in their healthcare and be proactive and,
Mhm.
do this, but also not be paralyzed and in a
Yeah.
constant state of panic and fear.
Right.
We're
Right.
trying to
Right.
always balance those. And at the end of
Yes.
the day, we really want to make sure that what happened to Johanna doesn't end up happening to you.
Exactly.
That's what we're trying to
Exactly.
do. And so
Yeah.
if folks are like, yeah, this wasn't there last month, if
Mhm.
they see something that they're not sure what it is and it's new, what kind of advice, what should their next steps be, in
Mhm.
your opinion?
So definitely, if you see something, my motto is, and I say it all the time: if you see something, say something. Now, who do
Mm-hmm.
you say it to? A doctor.
Yes.
So if you don't already have established care with a primary care or a gynecologist, definitely establish care, make an appointment. And as you already mentioned, unfortunately, especially in the US and Canada, there are these lengthy periods of wait if you don't already have established care. And even with established care, the wait can be long.
100%.
While you're waiting, keep a check on it, keep examining yourself, keep taking pictures. And then when you see a doctor, discuss the issue, discuss what you're experiencing, not just the visual change, but with vulvar cancer, we also want to look out for sensory changes like pain
Mm-hmm.
and burning, uncomfortability, soreness, these types of things. Tell your doctor in detail and in depth what you saw and what you feel. It's
Mm-hmm.
important. And then also, when you do see something and you go to a doctor to say something, don't say, I have a lump in my vagina. Don't say, my vagina hurts, because if you refer to the outer area
Yeah.
as your vagina, then a doctor will assume it's internally, because your vagina is internally, your vulva is external. Make sure you
Mm-hmm.
use proper terminology, because it also helps in, quickly figuring out what the issue could possibly be. And then, um, you know, definitely insist on a diagnosis. And if any kinds of tests are necessary for a diagnosis, have those tests done. Don't just accept the diagnosis that was done by visual examination only. Insist on confirmation of the assumption, because when it's based on a visual only, it's really just an assumption and not a diagnosis, because it
Mm-hmm.
didn't get confirmed, right? So definitely insist on a diagnosis and on confirmation of that diagnosis. And then also, for those who do continue to get worse, now you may not want to jump straight right away to the conclusion of it's cancer. Your
Mm-hmm.
doctor may not think right away that a biopsy is necessary if your case is not severe. Now, if you're already a severe case like me at the time, and you
Mm-hmm.
have several, ulcers and several lumps and several areas of hyperpigmentation, in that kind of situation, immediately insist on a biopsy. There is something you can do that I wish I would have known while I was going through the 5 year long diagnostic stage. And that is that you can ask a doctor to document their refusal of any type of test that you're
Yes.
asking for.
100%.
So ask them to document their refusal. Once they document their refusal, get a copy of their refusal. Now, but here's the thing. The majority of doctors don't want to document the refusal of a
Mm-hmm.
test that could that could diagnose the issue, like such as biopsy, scans, or whatever it may be, right? So the majority of doctors will go ahead and order a biopsy. You will still find some who won't and will document their refusal. If that happens, get a copy and then
Mm-hmm.
get a second opinion. Find a new physician, get a second opinion, and then start the process all over again. Now, it can sound tiring, and
It
it's
is,
actually
yeah.
unacceptable that we need to go through this,
Mm-hmm.
and jump through so many hoops. And I have patients in the support group, in the vulvar cancer support group, who had to go through this 3, 4, 5 times, meaning every time the doctor did document a refusal and they had to find a new doctor and, keep going until they finally got to one who said, I'm going to do it. And it's sad. It's sad. It's unacceptable. It's angering, and it feels dehumanizing sometimes. Like we don't matter. Our lives don't matter. But if I can say anything else, be your own advocate. Don't be afraid to speak up because you owe it to yourself to speak up.
Mm-hmm.
You are worth it, so to speak. Sometimes you have to tell people like, listen, you're worth it. You're worth it to get everything necessary medically that you are in need of. But you can't get it if we don't, if they don't know what's happening. So you're worth it to advocate for yourself. You owe it to yourself and you're worth it because your life matters. You
Mm-hmm.
matter. You are valuable. And, you are needed in this world, in this time and space that we're in. You're needed in your family, in your circle of friends, in your community. And so, and then as I said, you need it for yourself, this whole self love. Listen, advocating for yourself is a
Is
measure of
self-love.
self love.
100%.
Self care. It's self care to advocate for yourself. So don't be afraid to speak up because at the end of the day, this is what we have to keep in mind. Even though physicians play authority figures, they're not. They're working for us. And you can fire your doctor,
Mm-hmm.
you
Yep.
know?
Something that I
Yeah.
heard way later in life. No one ever
Exactly.
told
I
me
wish I
growing
would have
up.
known those things, right? I wish I would have
Yeah.
known those things that I know now.
Oh,
Yeah.
100%. I grew up where it was like kind of blind faith, right? Like
Mhm.
you
Mhm.
don't question the doctors because they
Mhm.
know better than you. And that's the
Exactly.
narrative that I worked with up
Mhm.
until the point
Mhm.
that I got my LS diagnosis. And my
Mm.
LS diagnosis was what caused me to start reflecting on those
Yeah.
narratives and to
Yeah.
start breaking them down and being like, wait, this makes no sense.
Right. Right.
This
Right.
is not
Mm.
okay. And we need to change that narrative
Mhm.
because, again,
Yes.
people's lives
Yes.
are
Yes.
literally at stake here. And,
Absolutely.
one thing that always frustrates me when I give advice about advocating, and I'm sure you feel this too,
Mhm.
is I could go on for days, giving tips for how to advocate for yourself at each
Mhm.
phase of the way.
Mhm.
It frustrates me that I have to give this advice at all.
Yes. Oh my
I'm like,
gosh.
I shouldn't have to tell you this. You should
Yeah.
not. You're
Yeah.
sick. You should
Yeah.
not. The burden should not be on you to do
Exactly.
so much work. And
Exactly.
I wish that you and I both didn't have to say
Mhm.
any of this.
Yeah. Yeah. I
But
do
the
too.
unfortunateness of the
Yeah.
situation is that how the medical system is run right now,
Mhm.
we do need to advocate, and we
Yes.
need to advocate hard. And you are an
Yes.
incredibly brilliant example of what advocacy looks like, what
Mm.
self advocacy looks like, and I was
Mhm.
thinking,
Thank you.
I was thinking too, like I always tell people if they refuse, tell
Mhm.
them, I want you to document that on my
Yeah.
chart because 9 times
Yeah.
out of 10, when they hear that, they're like, ugh, fine,
Right.
we'll run the
Exactly.
test. And
Exactly.
again, it's unfortunate that we have to
Mhm.
go there,
Yes.
but I always tell people to do that because that
Right.
can be a huge factor that gets them to kind of switch,
Exactly.
their
But also,
opinion.
right. And also, it's not only because it's this huge factor that can get them to switch their opinion, but you also want to ask them to document their refusal and get the copy if they
Yes.
do, because it can be something that can be used to sue them later if it should be something extremely severe, like in my case, and where there is a case of medical negligence,
Yeah.
So that is something else. I'm not saying, every time a doctor refuses, run to a lawyer, right?
No,
You
but
know,
have it.
but
Have it. You know,
have it
if
in
you
your
need
record. Right,
it.
exactly.
Yeah. And again, you know, this ties into what you just said, but also your story when you were like, I've sat here, I know
Mhm.
my rights.
Mhm.
And I was like, yes, know
Mhm.
your rights. And this is another
Yes,
part of advocating for yourself. Know your rights
absolutely.
as a patient.
Yes.
Know what you are entitled to. Know what your
Yes.
care should look like.
Yes. Yes.
Again, it's
Sorry.
you shouldn't have to read their rights back to them.
Exactly.
You know what I mean?
Exactly.
But
Yeah.
you know, ultimately, like when that switch flipped, and you were
Mhm.
like,
Mhm.
absolutely not. I am not leaving.
Mhm.
I know my rights. You're going to put
Yeah.
this on my chart and whatever. And she
Yeah.
was like, ugh, here.
And that's when
But
I was just fed up. But we shouldn't have to get to the point of being tired of, being tired of being tired or sick of being sick, It shouldn't have to
exactly.
come to that. But, another big issue or big reason rather why self-advocacy is so important is that there are unfortunately no real protocols right now for vulvar cancer or even lichen sclerosis, right? So there is
Yeah.
no protocol that says when an individual comes in and presents with all the symptoms of lichen sclerosis or vulvar cancer, right? They present with all the symptoms even
hmm
though they may not fit the age category that we
Yes.
typically see this in, even though they may not fall into the risk factor categories,
hmm
do a freaking biopsy.
Yep.
That protocol that establishes that what needs to be done. This is what needs to be done. It doesn't exist, so it's up to a physician's discretion on what they want to do, and
Yep.
this is what we are fighting so hard about too. We're constantly in communications with, I don't want to call them out right now and start trouble, but, so I'm just going to say with the
Yeah.
places and organizations and people that have the power to put these protocols into place. And the resistance is mind boggling.
I know.
It's absolutely mind boggling and appalling. Here we have people dying left and right from vulvar cancer, or even, lichen sclerosis patients that turn into vulvar cancer patients because of the lack of diagnosis and care and maintenance. But I just want to put this out there. Our support group, the vulvar cancer support group, right? We have had the highest mortality rate within our group over the past year and a half than we ever had since the establishment of the support group, which has been 5 years now.
Wow.
And so, in the past year and a half, get ready for this number, we have lost 39 people. 39.
That's
39.
that's not okay.
Just within a support group of like, how many are we now? 600 something people within, yeah, I think it's 600 something. So take that number in comparison to the overall number of the group. 600, I think it's 37 right now, 637 and
Mm,
39. That is a very high number. And so, yet we're still not we, you and I, but the medical community still
yeah.
classifies it as rare with a very low mortality rate. How can that be when just out of 637 people,
Agree.
39 died in a time frame of, I think it was, let me see, 15 months. 15 months.
Yeah. That's
So there's
unacceptable.
another flaw.
And again, you're correct. Their resistance
Yeah.
towards a simple protocol. It's actually it's not even a complicated protocol. If you think
Right.
about how many different types of medical tests and how complex those can be,
Mm-hmm.
a biopsy is actually quite simple.
Yes.
Um, and their resistance to that
Yeah.
truly speaks
Mm-hmm.
volumes as to
Mm-hmm.
what kind of human beings are valued
Yeah. Yes.
and what kind of human beings
Unfortunately.
are not being
Yes.
valued.
Yes.
And I commend you for all of your advocacy work that you do to push
Yes.
for these
Yes.
changes. And I hope that folks
Yes.
watching, you know, if
Yes.
anybody wants to get involved, with this advocacy. I'm
Mm-hmm.
sure Johanna would love to hear from you.
Yes,
We need as many
absolutely.
people as we
Yes, we
can.
need volunteers. I mean, oh my goodness,
Yes,
we're getting
yes,
ready to
yes,
put the
yes.
word out. We need
Like,
volunteers to help us with our social media pages. We
gosh,
need volunteers that are content creators. We need volunteers that literally help us communicate with these places, you know. So
yeah.
we're getting ready to put the word out about that. By all means, if you want to get involved, please reach out to us, and you know, we'll partner with you, and we'll see where you fit in to
Mhm.
make it happen.
That's just it. There's no such thing as too many people in this space, in my opinion.
Absolutely not.
You know, whether you are volunteering with Johanna or another
Hmm.
vulvar
Yes,
cancer,
yes,
advocacy group or
yes,
Lichen Sclerosus support network,
yes,
we need people,
yes.
okay?
We're
Like
working off for the
change,
same cause.
but
Yes,
that's just it, and I
yes.
think there's so much power when we all unite
Hmm.
and come
Absolutely.
together and fight for this. So if you are
Yes.
watching and you want to, help create that change, then
Hmm.
definitely you can follow Johanna at Vulvar
Yes.
Cancer Awareness on Instagram and Facebook,
Yes.
and DM her there and be like, hey, I'm interested. What can I
Hmm.
do? And don't think that you need to be a
Yes.
social media wizard. By the way,
No.
we're not looking for like a
No.
CV resume with all these
Exactly.
impressive credentials. We
Right.
are just human beings
Yes.
with no special credentials,
Yes.
just doing everything
Yes.
we can to help change this
Exactly.
landscape. We want that
Yes.
number down. 39 is
Yes.
too high. In a
It's
group of
way
that,
too
it's
high.
too high. That's
It's too
not
much.
okay.
Yes.
We
Mm.
truly, truly, truly need to change this. So again,
And to, I'm sorry if I can insert that
mhm.
39, the number of
Yeah,
39,
please do.
the youngest in that number, just what was it, 2 months ago now, I think, 24. She was 24. Beautiful soul from Australia. She was 24. And the youngest that passed away in the overall existence of our group was 18 years old. She was only 18, but she already had been let down by the system because she had system issues for years. And the mother shared with me that the doctor literally kept saying, this cannot be cancer. The mother Googled and vulvar cancer came up, and she brought it, up to the doctor. And the doctor said, oh, this can't be vulvar cancer. She's way too young. She's way too young. And
Just test.
by the
Just
time she was
test.
diagnosed at 18, she was terminal. She was terminal. Yeah.
And
So
think
that's
about,
what gets me emotional. I'm
of
sorry.
of course, no, please. I always welcome all emotion. There's no need to hide that or be ashamed. That is heartbreaking. It's absolutely heartbreaking. I mean, 18 years old, that's a child. And to think that so much of this could
Yeah,
be avoided with a biopsy,
absolutely.
to think that this could be avoided if doctors just listened to us, listen to us when we tell you something is off, when
Right,
we tell you, I don't think this is yeast,
right.
because the thing is that your story unfortunately isn't unique.
No, it's not.
So many,
No,
like
it's not.
every vulvar cancer story I hear, it's
Yes,
misdiagnosed for
yes,
decades. It's
yes,
yeast.
yes,
It's like you
yes,
fighting so aggressively for a
yes,
biopsy. And when we
yes.
put this all in perspective, again, just coming back to the early prevention,
Hmm.
the lives that could be saved, the
Right.
trauma, the
Yeah.
trauma that could be
Hmm.
avoided, because, and this could be a whole different video, but
Yes, yes.
the PTSD that comes with a cancer diagnosis, like that doesn't
Yeah.
go away when
Listen,
there's
that
no,
is real.
that doesn't go away
PTSD
when
with
you reach that
cancer is
5-year
real.
remission.
Yes, it's
Exactly. So it's
real.
like this trauma is something that you carry,
Yeah.
and you carry that because you were let down, because these protocols are not set up. And
Hmm.
again, we're not even talking about a complex protocol. This is really, really simple.
So
Like,
simple.
and again, I really, their resistance to me really speaks volumes as to which human beings are valued and which human beings are
Yeah,
not. But that
absolutely.
said, we are not going to give up. We're
No,
not
we're
going to give
not.
up just because
Mm-mm.
they're resistant. That does not mean that we're throwing in the towel.
Absolutely.
On the contrary, it means we're going to get louder.
That's it.
It means we're going to get louder, and we are going to get more strategic about how we're communicating with these organizations. It means we are going to mobilize. We are going to get together more people from across the globe to, you know, that's how change occurs. And that's what we're going to do. I'm not going to pipe down. You're not going to pipe down. I know everybody else fighting for this cause is not going to pipe down. The people that are, you know, really standing at the front line as advocates, these are tenacious people that have a fighting spirit that is giving me like goosebumps everywhere. But yeah, we are not giving up. So again, if anybody wants to volunteer, help Yohanna out with this cause, again, please reach out to her. Please give her a follow no matter what, because she posts some really important educational and support resources. Check out those Facebook groups. Those will all be linked in the description box below. Please do your monthly vulva check. Please look out for these signs. If you notice any changes, please don't hesitate to call the doctor, ask them to be put on a cancellation list, you know, call them back in 2 weeks. Are there any cancellations? This growth is spreading, it's growing. Give them that sense of urgency and advocate. Take all of Yohanna's amazing advice and advocate for yourself. So Yohanna, before we kind of close out, did you want to say, is there anything we didn't get the chance to say that you wanted to say?
No, I think we covered everything, and how do you say, and then some.
Yeah,
So
which is good, because it's very important
discussion. And we covered. I think we covered so much today, and that has been more than sufficient.
Great. Well, thank you so much for showing up and having this conversation with us and sharing this knowledge. We so appreciate you. And again, to our viewers listening, if you have any questions or concerns, please leave them in the comment section below, and we will do our best to answer those. So that is it for this video. We will catch you in the next one. Bye.